Hello, friends. Welcome to episode 136 of Experian's Data Talk podcast and video show featuring data science leaders and technologists from around the world. My name is Mike Delgado. Today, we're grateful for the opportunity to chat with Marcelo Pimenta, Experian's head of data labs in Latin America. In today's episode, we learned how Marcelo led his data science teams in São Paolo, Brazil, to quickly launch COVID Radar, a data platform to help healthcare workers, universities, and other global organizations track and fight COVID-19. This innovative project led Experian to partner with BCG, EY, Microsoft, United Nations, the World Observatory of Human Affairs, and many others. In fact, this data science project was launched by Experian in less than 3 weeks and earned the support of countless organizations, including Amazon, SAP, Zendesk, Azul, IntelliGov, Tableau, and many others. Here's our conversation. Marcelo, thank you so much for being on Data Talk.
My pleasure, Mike. My pleasure. Thank you.
Before we get started, I want to find out how you're doing. Working from home right now?
Oh, man. It was a kind of surprise. No one was happy for this kind of disruption. I have two perspectives. One, I think that we did very well in terms to swap the team to work from homes and keep the operation, keep the projects, and keep everything run as usual. And on the other hand, as you know, we decided to do something about that. So we decided to create an initiative called COVID Radar, and I think that we are well succeed in terms to create impact and help people during this pandemic. Mike, it's a very we live it in a very emotional moment in February, March. The uncertainty was high, and the feeling of the people was what I can do to try to contribute or try to help in any way. So we were completely unhappy, especially the way that we were fighting against C-19, because it's like 100 years ago. So the government just locked down with no more information or any details to the population. And, we live in an information society. So now every day we create several data about us, about our location, about our feelings. And we thought, hey, we can use our assets that we have here in Experian and try to create something to help people, governments, and other stakeholders in this situation. So I think, Mike, that it's one of the benefits to have something like data labs in the company, and a place that we have the autonomy to take the action in moments like that. So we didn't need to prepare a business case and explain why we want to do this kind of thing. We simply decide, and we align, of course, with the executives of the company, but basically propose, hey, we have several assets in our lab. We have the ability to track and monitoring and extract insight from smartphones. We have a brand that allow us asking data for several companies, including competitors, to treat these data sets in our environment. And we think that we also have the brand that it's a kind of a neutral actor in this situation. During the pandemic, several companies tried to use this moment to appear to the public, say, hey, I'm doing something against C-19. But we propose to do this movement completely for free, and we would be able to create a coalition of more than 50 companies. And these 50 companies, did the agreement to, at least for 6 months, work together against C19. So, man, it was great because we would, in 20 days, get information from 65 million smartphones, 200 million people, 10 million companies in Brazil, all the hospital infrastructure of the country, and connect with several data sources where we would monitor and track the numbers in terms of contagions, deaths, and hospital occupation. And we decided to create this environment where we would provide information for three levels of people. Governments, very strictly and based on the municipalities, in terms of the number of municipalities and the projection that we have, and to academia. So the academia has a completely new data set of information because, most of these epidemiological models are based on theories and developments during the 90s and the beginning of 2000. And nowadays, we have more data and we have more insights to provide to these epidemiological models. So we decided to provide this information, all this information to universities. Around 50 universities worked with us, developing the new generation of epidemiological models. And we also create a very simple page for usual and ordinary people entering the website and check the numbers of his region. I think that it's the right thing to do, and we did the right thing. I'm very glad to work in a company that allow us take decisions and movements like that. It costs. So we are allocating people, we are allocating our data sets, anonymized of course, but we need to provide compliance, we need to provide privacy. We take the risk of data leak, but we did something very important to the country and to our consumers and clients also.
Yeah, it's absolutely beautiful. Like, number one, the passion that you all have to be able to tackle this and to start to think critically about, okay, what sort of data can we gather? How can we collect it? How can we make it useful to hospitals? How do we slow down this virus? And how do we also help healthcare workers and society in general? So, number one, your passion, but then also the speed at which your team worked, especially in the midst of needing to work from home. Like, during that time, it was like a mad shuffle. Like, everyone was like, go home. We didn't have that much data. I mean, originally, when I was told about it, it was like everyone's going home for 3 weeks, we were told originally. Like, everyone's working from home for 3 weeks, which is like a joke now. We look back, we're like, 3 weeks, what? But back then, it was like, oh, yeah, everyone stays home for 3 weeks, and then things will settle down. We'll get back to normal. Obviously, that didn't happen. And the fact that you and your team moved so quickly while working remotely, like, that was amazing. Like, that you could all just do that. I wanted to ask you about that process of being home and then needing to be working on this huge data project. How did you kind of rally everyone together and begin to think through, because now you're not all in the same room anymore. You're all having to be in different locations. How did you kind of bring everyone together and then sort out who's going to work on what?
Okay, Mike, two components. One technological component. Fortunately, all of us had the computers, the access, and the routine to work remotely. Not every week, but sometimes we work remotely. So we had procedures to work from home. That's one of the key things. The second one, we had one proposal. So because we know that we must to keep the operations and our projects at this moment, but something more strong and bigger than the projects appear. So we everyone in the team was completely focused on to build this project to happen. It's something interesting because we have 25 guys in the lab. 12 are working on this platform, and the other guys wants to work also in the platform. And the problem was to say, hey guys, I know, thank you so much for your offer, but we need also to keep the operation running. Please, if you will help us keep the operation running as while half of the team as developing this platform. So it helped a lot. And in fact, Mike, we really push to develop the first version of the platform. We work for 18 days, every day at least 14 hours, to build this first version. So we started on March 12th, and at the end of March we launched the first stage of the solution that we call it data lake. The most important part, because on this data lake we feed with all Brazil information, all companies information, mobile information, hospital information, and start to work with the academia. 18 days from the idea to the first delivery. So was incredible. And during this stage, we had several good feedbacks from the company and good feedbacks from the market. United Nations organized a meeting with 75 CEOs from the biggest companies in Brazil to introduce COVID radar as an initiative that we were leading, but United Nations was supporting and asking to other companies to contribute. So it's a unique opportunity to talk to 75 CEOs of your country. So it was really great. And at this moment, we decided that to not give any chance to someone think that we are using this situation to get any advantage. We decided to put it off the logos of the company. So we invested a lot, but we really realized that it's one of the key movements that we need to do in order to bring more people and more companies to the coalition. And it worked. It worked a lot because other companies came, and we would start a second stage of the solution, that it's a matching marketplace where communities, NGOs ask for help, ask for medicines, personal equipment, and other companies would provide by cash or by the material, and we do the match and provide them. So we sent ventilators to Amazon forest. We sent liters and liters of hand sanitizers to the whole country and other equipments also. So the impact was much higher, especially because we decided to do this movement. So answer your question, I think that we had the technology to support this job, and we also we have the focus and the proposal to work on.
It's amazing that in 18 days your team was able to develop this tool from the idea to actually implementation of this data lake, and then to start the amount of data that you're collecting and the models that you're building, and then like reaching out to academia, reaching out to other organizations that could also leverage this data to help out in this crisis, and to get like props from the United Nations and all these other organizations all over the world to like wanting to work with you. And then I love the humility to be able to go, you know what, having the Experian logo here probably isn't the best thing, because this is really a unite. In order for this to work, like we all need to be working together, and it can't be an Experian thing. It has to be a global thing that we're all partnering together. And so I love that you were like very intentional about, let's remove the Experian logo. We're working together on this. Like we set this up. Like this is going to be a tool that academics can use, health organizations can use, the United Nations can leverage, and like how can we get more organizations to feed into this? And we're going to be like now in the background, like kind of like let's keep building on this. Let's help to deal with this pandemic with data. So I love like your whole approach.
Yeah, it's not easy to explain sometimes because there are lots of exposure in a movement like that. But again, it's the right thing, and I'm really glad to work in a place that consider this kind of approach. So and Mike, 18 days for a solution like that also show to us that the company has the resource, the technological resource to do something like that. We would to do in 18 days because we have the brand, you have the procedures, you have compliance and privacy standards to convince competitors share their data with us. That's amazing part of this kind of initiative, and we have the willing to do. So when we add all these elements, we can do anything. So it's great, Forbes did an article writing and use our name, Experian, side by side with Google and Apple. So it's a kind of amazing thing. So I think that the highlight was Google, Experian, and Apple, tech giants fight against C19. No, priceless. No, priceless. It's a kind of recognizing that sometimes we don't consider it and recognize every day. But we have the resource and people resource and technology resource to do it.
Yeah, I mean, it just shows like how quickly your team moved, and also, like you said, because you had the technology, because you had the procedures in place, and because you and your team and Experian is so innovative, like this is the kind of stuff that like the scientists at Experian like love to work on. Like we see something, we see a problem, we see a challenge. Okay, how can we leverage what we know, use our data, and also what are other orgs that we can work with to get more data so we can help to maybe solve this issue with our data solution. So it's beautiful, and yeah, and to see that sort of headline in Forbes where it's like, Apple, Google, Experian, like tackling COVID-19, like it's beautiful. Like it's great to see all these huge tech companies coming together to focus in on this pandemic.
Yeah. It's great. It's great. But Mike, I think that it's a kind of example that we need to talk to people. Hey, we are able, no? So I don't know if you know, but nowadays COVID radar it's one of the biggest health infrastructure in Brazil. So what we are working at this moment is try to keep the legacy, and provide this infrastructure for all NGO to take care and build the new solutions and prepare the country to the new pandemics and spread disease.
I wanted to ask you, one of the things that I noticed, and what's really hard, is because data is so private, especially health data, for a good reason. it makes a lot of countries obviously hesitant to share health data with each other because it's citizen data, it's private data, and every country has their own rules and regulations, as you know. So I'm kind of curious, like your perspective on like because COVID-19 hit Brazil a little bit later, harder, because we noticed it first in Italy was where we really started to see, well, obviously China and then Italy, where we started to see the pandemic really grow. And so, like the data, like we were really curious, like how can we learn more about what was happening with the spread? And then it started hitting other regions. And you were in Brazil, which started to get the pandemic spread really hard a little bit later, like maybe, I don't know, was it 2 or 3 months after US? I'm not quite
Um,
sure.
yes, the delay to US, it's around 3 weeks to 3 to 6 weeks of delay. Okay, so when the curve starts to grow in US, uh, 3 weeks later it starts to grow in Brazil. But the it's something interesting. In Brazil has probably the unique curve because we had a peak and a very high plateau for months and months. Two other reasons. No, I think that we couldn't communicate very well, especially through the all instances of the government, what to do, how to treat, and basically each one of the municipalities had take their own decision in terms to do lockdowns and distribute the resources to the hospitals. Because we decided to build the platform to help, particularly the municipalities, and help them take decisions. That's one of the problems that we had during this time. Take decision in terms of which kind of data we would provide for which stakeholder, because unfortunately we were afraid to release too much data, and for instance, someone that believes that the Earth is flat, take the data, took your decisions, and publish something completely wrong. Because we work with a different approach and different access depending on the stakeholders. So for the academia, everything was open, and to government, especially panels with decisions, was open, and the general public, basically the numbers and the tendency for each one of the cities in Brazil. And even to academia that has access to everything, we decided to use completely anonymized data and create index to try to mitigate and try to provide visualizations about how the spread is, what is the behavior of the spread. So try to think that we find a zip code. Inside of the zip code, we create some zones, and we connect points, and we design the distribution of these movements in a map. So it's not possible to back and identify someone or some household, but you have information enough to try to understand which part of the city is a hotspot in terms of contagions, and it's not a hotspot. So it's a safe area where, for instance, you can open the business and the shops with some security. Okay. So fortunately, again, it's something that we developed based on some assumptions from past projects or former projects that we did in the past. Because we have the algorithms to anonymize and quantify and describe these densities through the cities and through the areas, and how this density, this cloud of people, and this cloud of infected people moving through the cities. So it's a IP that we developed. It belongs to Experian, and we would use in this project.
And that data is like super helpful for hospitals as they're like needing to know what types of supplies they need, their needs. Like that hotspot data is super important for them.
Yeah, Mike. I think that if you have more coordination between the instances of the governance, we would be able to do much more, because using this kind of technology, we can analyze how many people infected are going to the hospital, which time of the day, how they are back into their homes. So we would synchronize and try to minimize the contagion effects. But unfortunately, particularly in Brazil, we don't have this kind of coordination, integration between these instances, and we couldn't do it. It's something a little bit frustration. It caused some frustration because we have the tools to solve part of the problem, but it's depend on people, it's depend on communication, and it's depend on integration to help and to provide more impact. But I'm very confident that we are much better situation compared to 6 months ago in terms of the information, how good is the data, the predictions that we have. We developed an index called accelerometer, and we can use it with security in a very safe way to predict if you can, advise to people back to the offices or not. So in fact, we are using this map in Serasa to try to measure and control the return to the offices.
I wanted to ask you too about, as you're looking through the data, I know there's been some complaints that maybe some of the data that has been going out to different organizations has not been entirely accurate, maybe like questionable data. Yeah. And I'm wondering like how the models or how you look at data and try to guard against maybe inaccuracies or things like that.
Yeah. As any data project, 70% of the efforts is try to take care of the data quality. And there are some municipalities that we can work because the data is really bad. So what we developed was some strategy to try to overcome this kind of problem. And when we couldn't be precise, we up a level and try to have another vision about the place. So basically, if we couldn't define a model for a municipality, we zoom more 2 or 3 near municipalities and try to create a view for all of them. So we can reduce the data problems like that. And there are other trick things. For instance, the numbers from the hospital and the health system in Brazil, it's not exactly correlated for one municipality, one number. Because one health area sometimes has some municipalities. So you can also need to distribute some numbers through the other municipalities. So it's difficult because the population is different, the social demographic distribution is completely different, the population flow is also different, and you need to infer on that area. But it's a great problem, It's a great problem.
As a scientist, as you're like watching COVID-19 spread in different countries, and you're thinking, okay, it's a matter of time before it hits Brazil. So I'm just kind of curious, like your perspective, like living in Brazil and seeing it spread in different countries, did that give you some mental preparation for what was coming, or did it not prepare you at all?
Particularly in Brazil, the behavior of the curve, it's unique because we had a quickly growth, and then we are in a very high plateau for months and months. And just from 1 month to now, this number is falling. So it's completely different because most of the countries, as you know, we have a peak, and then there is a down, a second peak, another down. That's the behavior for most of the countries. I think that there are several theories about this reason. For instance, when the pandemic reached Brazil, starting our winter, it's one hypothesis. So the winter people would naturally be in a closed places.
Right.
We didn't have nice strong lockdowns. We had a kind of Brazilian lockdown. So people that would work from home. People that couldn't work from home go to work. So the problem is that we keep very high rates of the contagions during all the time, especially in the poor population. That's what was one of the problems. And because in some cities, in some municipalities in Brazil, we reached something called, I'm not sure about the name in English, but it's a kind of group immunity. So we reach group immunity in several cities in Brazil. And there is a standard number. It's around 60% in most of the articles around the world to reach this kind of immunity. But in Brazil, it's lower. So one of the guesses is the features of the profile of the population and the social demographic distributions. It makes that in Brazil, you reach this kind of immunization group or rate of immunization group in something like 40% of the population, 35 to 40% of the population. As a result, several cities in Brazil at this moment are reaching these numbers, and consequently, the numbers are fall. In other countries, what is happening is that the number of the cases it has the second and third peak, but the number of the death is down because the medical procedures nowadays it's completely different and much more efficient compared to 6 months ago. So what was one of the benefits of this war effort that we are.
I want to ask you too about your work with academics, and it is so cool that you have Experian and your team sharing data, working directly with academics, and also helping them improve their own models. And I'm curious about like what that was like and what that currently is like. We're partnering with universities.
I think that it's another advantage that we have as a company. Data Labs usually has one foot in academia, another foot in the business. You know? So it helps us quickly connect with these universities. And most of the universities have access to several data, but there is a unique kind of data that we can provide. That it's the correlation of social demographics with population flows. It's a unique asset that we have. So we are able to describe how population flows, how is the population flows through the cities, and we are able to define social demographic attributes. So, and we know that depending on the level of access to sanitizer procedures. Mike, we are a poor country, so I'm talking about have to bathroom in the home, the house.
Right.
Okay? So we are able to provide this kind of information to academia. So one of the work that we are doing at this moment is provide information to them to create this new generation of models. So several models that the people are working at this moment and create papers and create science and create knowledge at this moment, it's based on to add a new dimension that it's this mobility slash social demographic information in the models. So it's something that would be they couldn't access up to this project, and nowadays we are able to provide to them. So my guess is that in more maybe 6 months, 1 year, we having a sort of new papers and knowledge be created using Experian data, using COVID radar data from this platform. So there are as I mentioned, 15 universities work on these data sets. Three of them outside of Brazil, and one from Massachusetts. And sorry, I forgot the third one. But they are also interested in this data set because it's unique.
As a leader, I was wondering if you could share some advice for other leaders that are out there that are working with data teams, trying to lead data teams amid remote working situations, amid a health crisis or other issue going on. What advice would you give them as they are trying to build camaraderie, build a team, and also make sure that everyone is working effectively and optimizing their time?
Two things, Michael. One it's a recipe for remotely team. So we have you need to provide a routine in terms of daily meetings, planning, review. So the ceremonies, it's very important. Keep the ceremonies with the team as you did presentially. Okay, so it's one important point. For this particular time that we are living, you need to be careful in terms of the psychological and emotional side also, because we are in a home office not as an option, but we must be in our homes, and especially the beginning of the pandemic. Several people from the team have kids, very young kids, and they are not prepared to share their lives working and take care of the kids, especially kids, because even especially to them, you need to give attention. You need to provide some attention. So we had to adapt some of the ceremonies and some of the job to consider this situation. So be flexible and listen to the team. It's something very special. So we had several teams. We have people with different needs, but we need to find out a way to accommodate their personal needs with the team delivers. That's one point. There is this emotional component that we needed to learn how to deal with it, and nowadays I think that it's a problem solved. But we didn't know it 6 months ago, and we spent some time to understand and learn how to deal with it.
I remember last time chatting with you, you were talking about your love of sci-fi, and I'm curious, like during this time, have you had a chance to relax a little bit, read some favorite books, movies?
I decided to go to another side, Michael. And the other side was music.
Oh, yeah.
Yeah, I have I have 3 kids. 2 of them I study in another countries. So they back to home, and for me was something as a bonus in this pandemic, because I thought that I only met them during the Christmas and the New Year. And
Right.
suddenly all of them was in my home as 5 years ago. So all of us love music, and we decided to do some videos playing music. So
Oh,
we play together as a band, but also we asked another friends to contribute. So we asked for someone, hey, please record the bass from He Comes and Son. Hey, recorded the guitar one from He Comes and Son, and then we bring all these things and produce some videos during the pandemic. In terms of movies and science fiction, of course, especially during the first week, I think that I watched every single film about pandemic, about
right.
disease, about even zombies. I watched it also. Okay, but it's part of the curiosity was understand what is the worst case. But
Right.
but quickly I migrate to this more fun, and I play it a lot with my kids. No,
That is so cool. What instruments do you play? What do your kids play?
I play guitar, but my kids play piano, bass, guitar. They
Wow.
sing. Yeah, much better. Yeah. They
That
are
is
the
awesome.
yeah, much better than
And what kind of music do you guys play?
nowadays from Beatles to Katy Perry or Mick Minaj.
That is so cool. Man, we got to see the Marcelo band at some point on a Experian event. That is so cool. I had no
Yeah.
idea.
Do you play an instrument?
I win. I'm the worst. I can't play it. I have no musical ability. I have the worst. I don't have any sort of rhythm. That's my problem. So my wife, my kids make fun of me because I can't even clap to a beat. We'll be somewhere, and my wife and my son are very musical. Like my son does drums, and he's also very good at dancing. But he's on a beat. Like he knows how. Trying to get. He's probably going to get into some instruments next, other instruments. Um, but I'm terrible. So I actually tried doing guitar for like 2 years. I played guitar almost every day
Yeah.
and just basic chords, but I am like the worst.
No, they have talent. I don't have talent. I needed to study a lot to play like a ordinary guy that plays some instrument.
Yeah.
No, but I needed to practice a lot. Practice a lot. They have talent. So sometimes they listen to music and start to play it.
Wow.
Suddenly playing the song. It's horrible, horrible. See how is they do. No, I need to practice. I need to sometimes read the chords and then play. It's another point that I also I'd like to be a musician, and I couldn't be. So I'm head of the data lab nowadays. I
Your
couldn't be
default.
a science
You had to
fiction
fall back on
writer.
that.
Exactly. I couldn't be an astronaut, but I'm head of the data lab. No.
It's your safety. That's great. Well, Marcelo, before we go, advice or suggestions for organizations or businesses that want to partner up with you on COVID Radar or any other projects?
Okay. Regarding COVID radar, we can also you can send an email marcelo.pimenta@br.experian.com, and I introduce you to the right people to be part of the coalition. What are the other questions,
Oh,
Mike?
for other people listening in that are just fascinated by the work your team does, and also have the speed and also innovation of your team, and they want to
Yeah.
get involved, they want to learn more about how do I partner with you?
Good. Mikey, we have a very intense agenda in terms of webinars, meetups, and the guys from the team usually are speaking in some events. So we recorded these events, and some of them are available on the internet, so you can find, just type in Data Labs Serasa Experian, and you can find this stuff.
Well, Marcelo, thank you so much for being on Data Talk. Number 2. Second time.
Number 2. Mike, it's always a pleasure talk to you. Very good.
Thank you so much for listening to this episode of the Data Talk podcast. We share new shows every week, and you can find the full catalog of previous episodes, including YouTube videos, on our Experian news blog. You can get access to the full catalog by going to experian.com/datatalk. And we always love hearing from our community, so if you have any comments or suggestions for future shows or guests you'd like to hear from, please let us know. You can leave a comment on iTunes, or you can reach out to us on Twitter at Experian Data Lab. You can also email me directly. My email is michael.delgado@experian.com. Take care, and we'll chat next week.